1. What is the primary mode of inheritance for Huntington's disease? A. Autosomal recessive. B. X-linked dominant. C. Autosomal dominant. D. Mitochondrial inheritance. Answer: C. Autosomal dominant. Rationale: Huntington's disease follows an autosomal dominant inheritance pattern. This means that an affected individual has a 50% chance of passing the disease to their offspring. The other options are incorrect for this genetic disorder. 2. Which part of the brain is primarily affected in Huntington's disease? A. Medulla oblongata. B. Basal ganglia. C. Cerebellum. D. Hippocampus. Answer: B. Basal ganglia. Rationale: Huntington's disease primarily affects the basal ganglia, which plays a key role in motor control. Damage to this area leads to the characteristic motor symptoms of the disease, such as chorea. Other regions are not the primary site of damage. 3. Which of the following is a hallmark symptom of Huntington's disease? A. Muscle weakness. B. Uncontrolled movements, chorea. C. Tremors at rest. D. Seizures. Answer: B. Uncontrolled movements, chorea. Rationale: chorea, or involuntary, jerky movements, is a hallmark symptom of Huntington's disease. Muscle weakness and tremors may occur, but are not as characteristic. Seizures are not typically a defining symptom of Huntington's disease. 4. At what age do symptoms of Huntington's disease typically first appear? A. In infancy. B. Early adulthood, 30 to 50 years. C. After 60 years. D. Childhood, 5 to 10 years. Answer: B. Early adulthood, 30 to 50 years. Rationale: symptoms of Huntington's disease typically begin to manifest in early adulthood, usually between ages 30 and 50. This is when motor and cognitive symptoms are first noticeable. Symptoms may occur later in some individuals, but this is the most common onset. 5. Which of the following genetic tests confirms the diagnosis of Huntington's disease? A. Chromosomal analysis. B. Blood tests for bilirubin. C. DNA analysis for CAG repeats. D. MRI brain scan. Answer: C. DNA analysis for CAG repeats. Rationale: DNA analysis for the CAG repeat expansion in the HTT gene is the definitive test for diagnosing Huntington's disease. MRI and chromosomal analysis are not used to confirm the diagnosis. Blood tests for bilirubin are unrelated to Huntington's disease. 6. Which psychiatric symptom is commonly associated with Huntington's disease? A. Depression. B. Euphoria. C. Mania. D. Paranoia. Answer: A. Depression. Rationale: depression is a common psychiatric symptom of Huntington's disease, often preceding the onset of motor symptoms. Other psychiatric conditions, such as euphoria and mania, are not typically associated with the disease. 7. Which of the following is the most common pharmacological treatment for managing chorea in Huntington's disease? A. Antidepressants. B. Antipsychotics. C. Benzodiazepines. D. Tetrabenazine. Answer: D. Tetrabenazine. Rationale: tetrabenazine is a common medication used to reduce chorea symptoms in Huntington's disease. It works by depleting dopamine, which is implicated in chorea. Other medications like antipsychotics or antidepressants are not typically used for chorea. 8. Which of the following best describes the cognitive decline seen in Huntington's disease? A. Sudden memory loss. B. Gradual decline in executive function. C. Severe language impairment. D. Visual hallucinations. Answer: B. Gradual decline in executive function. Rationale: cognitive decline in Huntington's disease is typically gradual and affects executive functions, such as planning and decision-making. It is not present as sudden memory loss or severe language impairment. Visual hallucinations are not characteristic. 9. What is the estimated life expectancy after the onset of symptoms in individuals with Huntington's disease? A. 5 to 10 years. B. 15 to 20 years. C. 20 to 25 years. D. 30 to 40 years. Answer: B. 15 to 20 years. Rationale: The average life expectancy following the onset of symptoms is typically 15 to 20 years, though this can vary based on the individual and disease progression. The other time frames are either too short or too long for the typical disease course. 10. What role does genetic counseling play in managing Huntington's disease? A. It helps identify unaffected family members. B. It provides information on managing symptoms. C. It aids in decision-making regarding genetic testing. D. It determines the age of onset. Answer: C. It aids in decision-making regarding genetic testing. Rationale: genetic counseling helps individuals understand the implications of genetic testing, the likelihood of inheriting or passing on the disease, and the emotional aspects of a positive diagnosis. It does not directly affect symptom management or determine age of onset. 11. Which of the following is a characteristic feature of the motor symptoms of Huntington's disease? A. Rigidity. B. Bradykinesia. C. Chorea. D. Resting tremor. Answer: C. Chorea. Rationale: chorea, or involuntary, jerky movements, is a hallmark of Huntington's disease. Rigidity, bradykinesia, and resting tremor are more common in Parkinson's disease. Chorea distinguishes Huntington's disease motor symptoms. 12. Which diagnostic imaging technique is often used to assess brain atrophy in Huntington's disease? A. CT scan. B. MRI scan. C. PET scan. D. EEG. Answer: B. MRI scan. Rationale: MRI scans are commonly used to observe brain atrophy, particularly in the basal ganglia, which is characteristic of Huntington's disease. CT scans, PET scans, and EEG are not as commonly used to monitor this condition. 13. Which of the following symptoms is not typically seen in Huntington's disease? A. Difficulty swallowing. B. Memory loss. C. High blood pressure. D. Personality changes. Answer: C. High blood pressure. Rationale: high blood pressure is not a common symptom of Huntington's disease. Symptoms include difficulty swallowing, memory loss, and personality changes, but hypertension is not typically associated with the disease. 14. What genetic abnormality is responsible for Huntington's disease? A. Mutation in the HTT gene. B. Deletion of the SOD1 gene. C. Mutation in the GAA repeat. D. Expansion of CAG repeats in the HTT gene. Answer: D. Expansion of CAG repeats in the HTT gene. Rationale: Huntington's disease is caused by the expansion of CAG repeats in the HTT gene, which encodes the protein Huntington. This mutation leads to neurodegeneration. Other options are related to different genetic disorders. 15. Which of the following is a common psychiatric symptom in patients with Huntington's disease? A. Delirium. B. Anxiety. C. Mania. D. Paranoia. Answer: B. Anxiety. Rationale: anxiety is commonly observed in patients with Huntington's disease, along with depression. Delirium, mania, and paranoia are less frequently seen in this condition, although some psychiatric symptoms can occur. 16. What is the first motor symptom typically seen in individuals with Huntington's disease? A. Resting tremor. B. Dysphagia, difficulty swallowing. C. Chorea, involuntary movements. D. Muscle rigidity. Answer: C. Chorea, involuntary movements. Rationale: chorea is typically the first motor symptom in Huntington's disease, often presenting as jerky, involuntary movements. Dysphagia and rigidity develop later in the disease course, and resting tremors are not characteristic of Huntington's disease. 17. Which of the following is not a possible complication of Huntington's disease? A. Heart failure. B. Pneumonia. C. Cirrhosis. D. Aspiration pneumonia. Answer: A. Heart failure. Rationale: while pneumonia, cirrhosis, and aspiration pneumonia are potential complications due to immobility and swallowing difficulties, heart failure is not typically a direct complication of Huntington's disease. 18. Which of the following treatments is used to manage chorea in Huntington's disease? A. Levodopa. B. Lithium. C. Tetrabenazine. D. prednisone. Answer: C. Tetrabenazine. Rationale: tetrabenazine is used to manage chorea in Huntington's disease as it helps reduce the involuntary movements. Levodopa is used in Parkinson's disease, lithium is used for mood stabilization, and prednisone is an anti-inflammatory drug. 19. What is the role of physical therapy in the management of Huntington's disease? A. It helps prevent motor symptoms. B. It improves cognitive function. C. It helps with movement coordination and reduces falls. D. It provides psychiatric support. Answer: C. It helps with movement coordination and reduces falls. Rationale: physical therapy focuses on improving coordination, balance, and strength to reduce falls and help manage motor symptoms. It does not directly improve cognitive function or prevent motor symptoms, but is crucial for functional independence. 20. Which of the following is the most common cause of death in individuals with Huntington's disease? A. Cardiovascular disease. B. Hepatic failure. C. Pneumonia or infection. D. Cancer. Answer: C. Pneumonia or infection. Rationale: pneumonia or other infections, particularly aspiration pneumonia, is the most common cause of death in Huntington's disease due to difficulties with swallowing and impaired motor control. Cardiovascular disease, hepatic failure, and cancer are less common causes. 21. Which of the following is a common cognitive symptom of Huntington's disease? A. Visual hallucinations. B. Memory deficits. C. Hyperactivity. D. Delusions. Answer: B. Memory deficits. Rationale: memory deficits, particularly with recall, are common cognitive symptoms in Huntington's disease. Visual hallucinations, hyperactivity, and delusions are less characteristic of this disease. Cognitive decline often worsens as the disease progresses. 22. At what age does Huntington's disease typically begin to manifest symptoms? A. Early childhood. B. Adolescence. C. Middle adulthood, 30 to 50 years. D. Late adulthood, 60 to 70 years. Answer: C. Middle adulthood, 30 to 50 years. Rationale: Huntington's disease typically presents in middle adulthood, between the ages of 30 and 50. Early childhood onset is rare, and symptoms typically develop before the age of 60. Late adulthood onset is unusual for this condition. 23. What is the role of genetic testing in Huntington's disease diagnosis? A. It confirms the presence of symptoms. B. It predicts the disease's severity. C. It identifies the presence of the HTT gene mutation. D. It helps to treat the disease. Answer: C. It identifies the presence of the HTT gene mutation. Rationale: genetic testing identifies the HTT gene mutation and confirms the diagnosis of Huntington's disease before symptoms manifest. It cannot predict the severity or treat the disease, but it can help with genetic counseling. 24. Which of the following is a hallmark neuropathological finding in Huntington's disease? A. Amyloid plaques. B. Lewy bodies. C. Brain atrophy in the basal ganglia. D. Hypermetabolic brain regions. Answer: C. Brain atrophy in the basal ganglia. Rationale: Huntington's disease is characterized by brain atrophy, particularly in the basal ganglia. Amyloid plaques and Lewy bodies are seen in Alzheimer's and Parkinson's diseases, respectively. Hypermetabolism is seen in some neurodegenerative diseases, but not in Huntington's. 25. Which of the following neurotransmitters is most affected by the neurodegeneration in Huntington's disease? A. Dopamine. B. Serotonin. C. Acetylcholine. D. Gamma-aminobutyric acid, GABA. Answer: D. Gamma-aminobutyric acid, GABA. Rationale: Huntington's disease leads to a reduction in GABA, an inhibitory neurotransmitter causing the motor and psychiatric symptoms of the disease. Dopamine and serotonin are involved in other conditions like Parkinson's and depression. 26. Which of the following is a potential early sign of Huntington's disease? A. Difficulty with walking. B. Hearing loss. C. Loss of taste. D. Seizures. Answer: A. Difficulty with walking. Rationale: Difficulty with walking and balance, along with subtle motor symptoms such as clumsiness, can be an early sign of Huntington's disease. Hearing loss, loss of taste, and seizures are not common early signs of this condition. 27. Which of the following medications is used to manage the psychiatric symptoms of Huntington's disease? A. Valproic acid. B. Olanzapine. C. Donepezil. D. Baclofen. Answer: B. Olanzapine. Rationale: olanzapine, an atypical antipsychotic, is used to manage psychiatric symptoms such as agitation and psychosis in Huntington's disease. Valproic acid is used for mood stabilization, donepezil is used for Alzheimer's, and baclofen is used for spasticity. 28. What is the prognosis for individuals diagnosed with Huntington's disease? A. Progressive with a life expectancy of 10 to 20 years after diagnosis. B. Cure is possible with early diagnosis. C. Remission of symptoms is common. D. Symptoms stabilize after age 50. Answer: A. Progressive with a life expectancy of 10 to 20 years after diagnosis. Rationale: Huntington's disease is a progressive neurodegenerative disorder with a typical life expectancy of 10 to 20 years after diagnosis. There is no cure, and symptoms do not stabilize after age 50. Remission is not common. 29. What is the inheritance pattern of Huntington's disease? A. Autosomal recessive. B. X-linked dominant. C. Autosomal dominant. D. Mitochondrial inheritance. Answer: C. Autosomal dominant. Rationale: Huntington's disease follows an autosomal dominant inheritance pattern, meaning that an individual only needs one copy of the mutated gene from one parent to develop the disease. Recessive, X-linked, and mitochondrial inheritance are not characteristic of Huntington's. 30. Which of the following factors is most associated with the earlier onset of Huntington's disease symptoms? A. Maternal inheritance. B. Age of the father at conception. C. Longer CAG repeat expansion. D. Use of alcohol. Answer: C. Longer CAG repeat expansion. Rationale: a longer CAG repeat expansion in the HTT gene is associated with earlier onset of symptoms in Huntington's disease. Maternal inheritance, paternal age, and alcohol use are not strongly correlated with earlier onset. 31. Which symptom would be most helpful in differentiating Huntington's disease from Parkinson's disease? A. Chorea, involuntary movements. B. Bradykinesia, slow movement. C. Resting tremor. D. Cognitive decline. Answer: A. Chorea, involuntary movements. Rationale: chorea, the involuntary jerky movements, is characteristic of Huntington's disease, while Parkinson's disease is more associated with bradykinesia and resting tremors. Cognitive decline is seen in both, but the presence of chorea is a distinguishing feature. 32. Which of the following is a potential risk factor for developing Huntington's disease? A. Older age at conception. B. Exposure to neurotoxins. C. Family history of the disease. D. Autoimmune disorders. Answer: C. Family history of the disease. Rationale: a family history of Huntington's disease is the primary risk factor for developing the condition due to its autosomal dominant inheritance. Older age at conception, exposure to neurotoxins, and autoimmune disorders are not linked to the disease's development. 33. In Huntington's disease, what is the primary pathology occurring in the brain? A. Formation of amyloid plaques. B. Degeneration of the basal ganglia. C. Accumulation of Lewy bodies. D. Demyelination of nerve fibers. Answer: B. Degeneration of the basal ganglia. Rationale: the primary pathology in Huntington's disease is the degeneration of the basal ganglia, particularly the striatum, leading to movement, cognitive, and psychiatric symptoms. Amyloid plaques and Lewy bodies are seen in other diseases, such as Alzheimer's and Parkinson's. 34. Which of the following is a non-pharmacological intervention to help manage symptoms of Huntington's disease? A. Deep brain stimulation. B. Cognitive behavioral therapy, CBT. C. Dietary changes alone. D. Chiropractic care. Answer: B. cognitive behavioral therapy, CBT. Rationale: cognitive behavioral therapy, CBT, can help manage psychiatric symptoms like depression and anxiety in Huntington's disease. Deep brain stimulation is used in Parkinson's disease, and dietary changes and chiropractic care are not commonly used to manage Huntington's symptoms. 35. Which of the following is not commonly seen in the late stages of Huntington's disease? A. Severe motor impairment. B. Involuntary movements, chorea. C. Progressive dementia. D. Emotional stability. Answer: D. Emotional stability. Rationale: emotional instability, including depression and aggression, is common in the late stages of Huntington's disease, along with severe motor impairment, chorea, and progressive dementia. Emotional stability is not typical in the later stages of the disease. 36. Which of the following is a potential challenge for individuals with Huntington's disease related to communication? A. Dysphagia, difficulty swallowing. B. Aphasia, language impairment. C. Hyperactivity. D. Dysarthria, difficulty speaking. Answer: D. Dysarthria, difficulty speaking. Rationale: dysarthria, or difficulty speaking, is a common communication challenge in Huntington's disease due to motor control issues affecting the muscles needed for speech. Dysphagia is also common but affects swallowing, not speech. 37. Which of the following best describes the pathophysiology of Huntington's disease? A. Decreased dopamine production. B. Increased acetylcholine activity. C. Loss of GABAergic neurons in the basal ganglia. D. Neuroinflammation in the cortex. Answer: C. Loss of GABAergic neurons in the basal ganglia. Rationale: the pathophysiology of Huntington's disease involves the loss of GABAergic neurons in the basal ganglia, which disrupts movement control and leads to the hallmark symptoms of the disease. Decreased dopamine and increased acetylcholine activity are seen in other conditions. 38. Which of the following genetic tests can confirm the diagnosis of Huntington's disease? A. Karyotyping. B. FISH analysis. C. PCR for CAG repeat expansion. D. BRCA mutation testing. Answer: C. PCR for CAG repeat expansion. Rationale: PCR testing for CAG repeat expansion in the HTT gene is the definitive test for diagnosing Huntington's disease. Karyotyping, FISH analysis, and BRCA testing are used for other genetic conditions, not Huntington's. 39. Which of the following physical symptoms in Huntington's disease is often mistaken for a psychiatric issue? A. Muscle rigidity. B. Chorea, involuntary movements. C. Hyperreflexia. D. Dysphagia. Answer: B. Chorea, involuntary movements. Rationale: chorea, the involuntary movements seen in Huntington's disease, is often misinterpreted as a psychiatric issue because of its erratic and uncontrolled nature. Muscle rigidity, hyperreflexia, and dysphagia are less commonly mistaken for psychiatric symptoms. 40. Which type of counseling should be offered to individuals who have a family member with Huntington's disease? A. Genetic counseling. B. Nutritional counseling. C. Physical therapy. D. Speech therapy. Answer: A. Genetic counseling. Rationale: genetic counseling is essential for individuals with a family history of Huntington's disease to understand the inheritance pattern, risk of transmission, and options for testing. Nutritional, physical, and speech therapy are not as relevant at the initial stage of counseling. 41. Which of the following is a common motor symptom in the early stages of Huntington's disease? A. Bradykinesia. B. Chorea, involuntary movements. C. Resting tremors. D. Postural instability. Answer: B. Chorea, involuntary movements. Rationale: chorea, which involves involuntary movements, is one of the hallmark early motor symptoms of Huntington's disease. Bradykinesia, resting tremors, and postural instability are more characteristic of other diseases like Parkinson's. 42. Which of the following psychological symptoms is commonly observed in individuals with Huntington's disease? A. Depression. B. Euphoria. C. Paranoia. D. Hypomania. Answer: A. Depression. Rationale: Depression is a common psychological symptom in individuals with Huntington's disease, often linked to both the neurological degeneration and the psychosocial stress of living with the disease. Euphoria and hypomania are less typical. 43. What part of the brain is primarily affected by Huntington's disease? A. Cerebellum. B. Basal ganglia. C. Cerebral cortex. D. Medulla oblongata. Answer: B. Basal ganglia. Rationale: Huntington's disease primarily affects the basal ganglia, leading to motor, cognitive, and psychiatric symptoms. The cerebellum, cerebral cortex, and medulla oblongata are not the primary areas of degeneration in this condition. 44. Which of the following is a common comorbidity seen in individuals with Huntington's disease? A. Asthma. B. Obesity. C. Sleep disturbances. D. Osteoarthritis. Answer: C. Sleep disturbances. Rationale: sleep disturbances, such as insomnia and irregular sleep patterns, are common in Huntington's disease due to both the disease process and psychiatric symptoms. Asthma, obesity, and osteoarthritis are not commonly associated with the disease. 45. Which of the following strategies is helpful for managing the motor symptoms of Huntington's disease? A. Regular exercise. B. High-protein diet. C. Resting and avoiding activity. D. High-carbohydrate diet. Answer: A. Regular exercise. Rationale: regular exercise is beneficial for managing motor symptoms in Huntington's disease by improving mobility, strength, and coordination. Diet changes alone are not effective in managing the motor symptoms. 46. What is the genetic mutation that causes Huntington's disease? A. Mutation in the HTT gene. B. Mutation in the BRCA1 gene. C. Mutation in the APO gene. D. Mutation in the HTT2 gene. Answer: A. Mutation in the HTT gene. Rationale: Huntington's disease is caused by a mutation in the HTT gene, specifically an expansion of CAG repeats. BRCA1 and APO genes are associated with other diseases such as breast cancer and Alzheimer's, respectively. 47. What type of inheritance pattern does Huntington's disease follow? A. Autosomal dominant. B. Autosomal recessive. C. X-linked dominant. D. Mitochondrial inheritance. Answer: A. Autosomal dominant. Rationale: Huntington's disease follows an autosomal dominant inheritance pattern, meaning that one affected parent has a 50% chance of passing the disease to their children. 48. What is the average age of onset for Huntington's disease symptoms? A. 20 to 30 years. B. 30 to 50 years. C. 50 to 70 years. D. 70 to 90 years. Answer: B. 30 to 50 years. Rationale: symptoms of Huntington's disease typically begin to appear between the ages of 30 and 50. Onset earlier or later than this is possible, but it is less common. 49. Which symptom of Huntington's disease is most likely to cause difficulty with daily living activities? A. Involuntary movements, chorea. B. Resting tremors. C. Dementia. D. Dizziness. Answer: A. Involuntary movements, chorea. Rationale: involuntary movements, chorea, often impair the ability to perform daily activities like eating, dressing, or walking. While dementia and tremors also contribute to disability, chorea is the most impactful motor symptom. 50. What is the role of deep brain stimulation in treating Huntington's disease? A. It is a first-line treatment. B. It is used to manage chorea. C. It is used to delay symptom onset. D. It cures the disease. Answer: B. It is used to manage chorea. Rationale: deep brain stimulation is used in certain cases of Huntington's disease to manage severe chorea when medications are not effective. It is not a first-line treatment and does not cure the disease.